Have you ever looked back at the last few months and suddenly realized that your sex life has almost disappeared? Maybe you are in your 50s or 60s and you have been single for a while. Maybe you went through a divorce, lost a partner, or simply became less interested in intimacy than you were when you were younger. Or perhaps life became complicated. Work, stress, health problems, medications, family responsibilities, and changing relationships can all push intimacy further and further into the background. And then one day, a question quietly enters your mind. Is something happening to my body because I'm not having sex anymore? It is a very understandable question, and the answer is not simply yes or no. The first thing you should know is that not having sex does not automatically damage your body. There is no specific number of times a man needs to have sex to remain healthy, and sexual activity naturally changes throughout life. Some men can go months or even years without sexual activity and experience very little physical or emotional difficulty. For others, a long period without intimacy may come with noticeable changes in desire, confidence, mood, erections, relationships, or even the way they think about themselves. But here's where things become interesting. The most important question may not be, how long has it been since I had sex? It may be, what else changed around the same time? Did your energy decrease? Did you stop exercising? Did your sleep become worse? Did you gain weight? Did you start taking a new medication? Did stress increase? Did you become more isolated? Did your interest in many things, not just sex, begin to disappear? These details matter because sexual health does not exist in isolation. Your brain, hormones, nerves, blood vessels, emotions, relationships, and general health can all influence what happens to your sexual function. And there is another important possibility that many men overlook. Sometimes a man thinks, I stopped having sex, so my desire disappeared. But in some cases, the direction may actually be reversed. A change in health, mood, hormones, medication, or circulation may have reduced his desire first, and the lack of sexual activity came afterward. That distinction can completely change how you look at the situation. So in this video, we're going to look at 7 changes that may occur when a man goes without sex for a long time, what those changes really mean, and which ones deserve more attention. And the 7th change may be especially important because it can sometimes point beyond your sex life to your overall health. But before we look at those 7 changes, we need to clear up one important misunderstanding about what sex actually does to the male body. Before we talk about what may happen when a man goes a long time without sex, it helps to understand what sexual activity actually involves inside the body. Many people think of sex as simply a physical act, but the reality is much more complex. Your brain, nervous system, blood vessels, muscles, hormones, and emotions can all become involved in the process. When a man becomes sexually aroused, the brain begins sending signals through the nervous system. Blood flow changes. The blood vessels supplying the penis respond, and different chemical signals help coordinate the physical response. At the same time, emotional factors can influence how comfortable, relaxed, connected, or interested a person feels. This is one reason sexual desire and sexual performance should never be treated as exactly the same thing. A man can have the physical ability to have an erection but have very little interest in sex. Another man may have strong sexual desire but struggle with erections because of anxiety, medications, circulation problems, diabetes, or other health factors. In other words, wanting sex and being physically able to have sex are 2 different parts of the picture. And there is another important distinction. Sexual intimacy can provide emotional experiences that are separate from intercourse itself. For some people, affection, closeness, touching, companionship, and feeling emotionally connected to another person can be meaningful parts of a relationship. Those experiences should not be confused with the physical act alone. Now, here is where an important myth needs to be addressed. Some men hear that if they stop having sex, their testosterone will somehow disappear or their body will stop functioning normally. That is not how the body works. Testosterone levels are influenced by many factors, including age, overall health, body composition, sleep, certain medications, and other medical conditions. Sexual inactivity by itself does not automatically mean a man has low testosterone. Think of sex more like one possible form of physical and emotional stimulation, rather than a maintenance procedure your body must perform on a schedule. You don't have to meet some magic number of sexual encounters to keep your body working properly. And that is actually good news. A man can have little or no sexual activity and still have a healthy body, strong relationships, good cardiovascular health, emotional well-being, and an active life. But there is an important however. The bigger concern is not always the absence of sex itself. It is what may be happening around that absence. If a man stops having sex because he simply prefers a different lifestyle, that is very different from suddenly losing all sexual desire while also becoming exhausted, gaining weight, sleeping poorly, feeling depressed, or developing erection problems. So if lack of sex isn't automatically harmful, why do some men notice very real changes after months or years without it? The answer begins with the first change, and it has less to do with what is happening during sex and more to do with what happens to your sexual desire when sexual stimulation and intimacy become less present in your life. One of the first things some men notice after a long period without sexual activity is that sex simply doesn't seem to occupy as much space in their minds as it once did. Maybe you used to think about intimacy regularly, notice attraction more easily, or look forward to being close to a partner. But after months or even years without those experiences, you may find yourself thinking about sex less often. That can be surprising, especially if you remember having a much stronger sex drive when you were younger. But here's something important. Libido is not an on and off switch. It can change throughout your life, and there is enormous variation from one man to another. Some men remain highly interested in sex well into their 60s and 70s. Others naturally become less interested. Neither situation automatically means something is wrong. Age can play a role, but age is only one part of the picture. Think about what happens when something gradually disappears from your daily routine. If you stop playing a sport you once loved, you may eventually think about it less. If you stop going out socially, you may become comfortable spending more time at home. Sexual desire can sometimes be influenced by a similar pattern of attention, habit, and context. When sexual opportunities, intimacy, dating, affection, and sexual stimulation are absent for a long period, a man may gradually become accustomed to a non-sexual routine. He may stop initiating intimacy, he may stop thinking about dating, he may even begin to believe, I guess I've just lost my drive. But that doesn't necessarily mean his body has permanently switched off. And this is where we need to look beyond sex itself. Imagine a 62-year-old man who notices that his interest in sex has almost disappeared. At first, he assumes it is simply part of getting older. But when he looks more closely at the previous year, he realizes that his sleep has become poor, he has gained weight, his stress has increased, he is exercising less, and his doctor recently changed one of his medications. Now, the situation looks very different. His reduced libido may have several possible contributors, rather than being explained simply by the fact that he hasn't had sex. Stress alone can make sexual desire less noticeable. Poor sleep can leave you exhausted. Depression can reduce interest in activities you once enjoyed. Relationship difficulties can affect desire. Certain medications and chronic health conditions can also play a role. This is why a low sex drive isn't automatically a medical problem. If a man is comfortable with his level of sexual interest and there are no other concerning symptoms, there may be nothing that needs to be fixed, but a sudden or unexplained change deserves more attention than a gradual change that a man is comfortable with. Sometimes the biggest clue isn't whether a man wants sex, it's what happened to his desire before he stopped having it. Was there a sudden change in health, more stress, poorer sleep, a new medication, weight gain, a relationship change? Those questions can tell you much more than simply counting how long it has been since you were sexually active. But desire is only one piece of the puzzle. The next change involves something many men think about first when they hear the words long-term sexual inactivity: erections. Now we come to a subject that many men over 50 think about almost immediately when they hear the phrase long-term sexual inactivity: erections. You may have wondered, if I don't have sex for months or even years, will my body eventually forget how to have an erection? The reassuring answer is no, not simply because you aren't having sex. Sexual inactivity does not automatically cause permanent erectile dysfunction, and there is no medical rule saying that a man's penis stops functioning because he has gone a long time without intercourse. But there is more to the story. An erection is actually a coordinated process involving the brain, nerves, blood vessels, and penile tissue. When a man becomes sexually aroused, the brain sends signals through the nervous system. Those signals help the blood vessels relax and increase blood flow into the penis. The tissue then expands and becomes firm. Think of the blood vessels as small roads. When those roads are healthy and open, blood can move efficiently. But when blood vessels become less healthy because of problems such as high blood pressure, diabetes, smoking, high cholesterol, or other cardiovascular issues, blood flow may not work as efficiently. This is one reason erectile function can tell us something about overall health. But don't make the mistake of assuming that every change in erection quality means you have a serious medical problem. Erections naturally vary. Sleep, stress, alcohol, medications, hormones, physical fitness, emotional state, and age can all influence them. Even spontaneous or morning erections can change over time. There is also another factor that can become important after a long period without sexual activity: anxiety. Imagine a man who hasn't been intimate with anyone for several years. Eventually, he meets someone he really likes. Instead of simply enjoying the moment, his mind starts racing. What if I can't get an erection? What if I lose it? What if she thinks something is wrong with me? That pressure can become part of the problem. Anxiety activates the body's stress response, and when your mind is focused on performance and failure, it can become harder to relax and respond naturally. Now imagine that the same man has a difficult experience once. He becomes worried it will happen again. The next time intimacy is possible, he becomes even more nervous. That creates a cycle in which fear itself can interfere with sexual response. This is why sexual inactivity and erectile difficulty should not automatically be treated as the same thing. At the same time, persistent erectile problems should not simply be dismissed as normal aging. If a man repeatedly struggles to achieve or maintain an erection, especially when the change is new, it can be worth discussing with a healthcare professional. Sometimes erectile difficulties can be associated with conditions affecting blood vessels or nerves, including diabetes and cardiovascular risk factors, and this is where regular physical activity becomes important. Walking, strength training, maintaining a healthy weight, avoiding tobacco, getting adequate sleep, and managing conditions such as blood pressure and diabetes can support cardiovascular health, which also supports healthy sexual function. So the message is not, you need sex to keep your penis working. The better message is, your sexual function is connected to the health of your entire body. And sometimes, a change in sexual function is not something to fear. It is simply information, a reason to pay closer attention to your sleep, stress, medications, fitness, and overall health. Because there is another side of this story that men often overlook completely: the mind. A man can have relatively healthy physical function and still experience major changes in how he feels about intimacy, confidence, and himself, and that is where our next change begins. There is another part of this conversation that is easy to overlook because it cannot be seen in a blood test or measured with a blood pressure cuff. It is the emotional side of intimacy. For some men, sexual intimacy is connected with affection, closeness, companionship, physical touch, and the feeling of being wanted by another person. When those experiences disappear, they may notice changes in their mood or emotional well-being. But there is an important distinction here. Not having sex is not the same thing as being lonely. A man can go months or years without sexual activity and feel completely comfortable with his life. He may have close friends, a strong relationship with his children, meaningful hobbies, community involvement, and plenty of social interaction. If he feels satisfied and emotionally connected, the absence of sex may not be a major concern at all. The situation can be very different for another man. Imagine a recently retired 64-year-old who has gradually stopped dating. He spends more time at home. He exercises less. He sees his friends less often. His daily routine has disappeared, and the relationship he once had is no longer part of his life. Eventually, he starts feeling tired, disconnected, and less motivated. He tells himself, maybe I just feel this way because I'm not having sex anymore. But look more closely. He hasn't only lost sexual activity. He has lost routine, physical activity, companionship, social interaction, and regular human connection. That distinction matters. Sometimes what a person misses is not intercourse itself, but the collection of experiences that may come with intimacy, touch, affection, conversation, closeness, laughter, companionship, and feeling emotionally connected. This is also why stress can become part of the cycle. When you're under constant stress, your mind may have less room for sexual interest. You're thinking about money, family, work, health, or other responsibilities. Sex may simply fall lower on the list of priorities. And then, the reverse can happen. When sexual desire decreases, a man may become worried about what it means. He may wonder whether something is wrong with his hormones or his masculinity. That worry can create even more stress, which can make intimacy feel even more difficult. Depression can also affect sexual interest. If a man suddenly loses interest not only in sex, but also in hobbies, friends, exercise, food, or other things he once enjoyed, that deserves more attention than simply assuming he has lost his sex drive. The goal is not to convince you that every man needs sex to be emotionally healthy. That's simply not true. The goal is to help you recognize the bigger picture. If you are sexually inactive but otherwise happy, connected, active, and healthy, there may be little reason for concern. But if sexual inactivity has come together with loneliness, withdrawal, persistent low mood, anxiety, poor sleep, or loss of interest in life, it may be worth looking deeper. So ask yourself a different question. What if the thing your body is missing isn't sex itself, but the movement, touch, connection, and emotional stimulation that sometimes come with it? And that leads to the fourth change, because sexual health doesn't exist in isolation from the rest of your lifestyle. Now, let's look at something that has very little to do with sex itself, but can become connected to your health when sexual activity decreases. Your overall level of physical activity. Sex can involve movement. Your heart rate may increase, your muscles may be active, and your body is certainly doing more than it does while sitting on the couch. But it is important not to exaggerate this. Sex is not a replacement for regular exercise, and you should never think, as long as I'm sexually active, I don't need to walk or work on my strength. Healthy aging requires much more than that. Walking regularly, maintaining muscle strength, working on balance and mobility, and getting appropriate cardiovascular activity are all important parts of staying physically capable as you get older. The interesting thing is that some men notice their sexual activity declining at the same time their overall activity begins to decline. Think about retirement. A man may spend decades getting up every morning, going to work, walking around the workplace, climbing stairs, commuting, and interacting with people. Then retirement arrives. Suddenly, there is nowhere he has to be at 8 in the morning. The first few weeks feel wonderful, but months later, he may realize that he is walking less, sitting more, exercising less frequently, gaining weight, and spending more time at home. At the same time, his dating life or sexual activity may have decreased. It would be easy to look at those changes and conclude, I'm unhealthy because I'm not having sex. But that may be looking at the situation backward. The bigger issue could be the overall lifestyle pattern. Less movement can affect cardiovascular fitness, muscle strength, energy levels, body weight, and the body's ability to handle blood sugar efficiently. And those changes can eventually influence many areas of health, including sexual function. In fact, the relationship can sometimes work in the opposite direction. Poor physical fitness, weight gain, stress, and cardiovascular problems may contribute to reduced sexual function in the first place. So rather than thinking, I need sex to stay healthy, a more useful way to think about it is, I need regular movement, healthy circulation, adequate sleep, strength, and meaningful connection to support my health. Those foundations can benefit you whether you are sexually active or not. And here's a simple test you can do right now. Don't just look at your sex life over the last 6 months. Look at your whole life. Has your daily movement decreased? Has your sleep changed? Has your weight increased? Is your energy lower? Are you spending more time sitting? Are you seeing friends less often? Have activities you once enjoyed slowly disappeared from your routine? Those questions can reveal a much bigger picture. And the good news is that lifestyle changes are often areas where you can take action. You don't need to transform your life overnight. Even gradually becoming more active and rebuilding a consistent routine can be a meaningful step. But now we reach a change that can be especially confusing after 50 because several completely different causes can produce the exact same symptom. And one of those causes involves hormones and medications. Now we come to one of the most misunderstood parts of men's sexual health after 50. Hormones. If a man's sexual desire decreases, one of the first things he may think is, my testosterone must be low. And while testosterone can certainly play a role in sexual desire, that conclusion is not always correct. Testosterone levels vary considerably from one man to another, and they can change gradually with age. But sexual inactivity itself does not automatically mean that testosterone has fallen to a dangerously low level. In other words, if you haven't had sex for 6 months, that fact alone cannot tell you what your testosterone level is. There are many other pieces to consider. For example, think about sleep. A man who regularly sleeps poorly may feel exhausted during the day, have less energy, feel less motivated, and notice less interest in sex. If that continues for months, he may assume his sexual health is the primary problem when his sleep may actually be part of the picture. Body weight can also matter. Excess body fat is associated with changes in metabolic and hormonal health, which can influence energy and sexual function. Then there are medications. Some medications can affect libido or erectile function in certain people. Medicines used for blood pressure and some medications used to treat depression or anxiety may have sexual side effects. That does not mean you should stop taking a medication on your own. In fact, doing that could create a much bigger health problem. Instead, if you notice a significant change after starting a new medication or changing a dose, bring it up with your healthcare professional. Sometimes there may be an alternative treatment, a dose adjustment, or another explanation worth investigating. And medications aren't the only possibility. Conditions such as diabetes and cardiovascular disease can affect blood vessels, nerves, energy levels, and sexual function. Stress, anxiety, depression, poor sleep, and other health problems can also influence desire and performance. This is why trying to diagnose yourself from one symptom can be misleading. Let's address one of the most common myths directly. The myth, if I haven't had sex for months, my testosterone must be dangerously low. The fact, sexual inactivity alone does not establish low testosterone. If you're experiencing persistent low libido, especially when it comes with unusual fatigue, reduced strength, significant mood changes, or ongoing erectile difficulties, it's much more useful to have a proper conversation with a qualified healthcare professional than to guess. And be especially cautious about products or hormone treatments promoted online as quick fixes. A supplement advertisement cannot tell you whether your symptoms are caused by testosterone, sleep, stress, medication, circulation, or another health condition. Your body is more complicated than a single hormone, and that is actually good news because it means there may be several areas that can be addressed. Sometimes improving sleep, becoming more physically active, managing a health condition, reviewing medications, or addressing emotional stress can make a meaningful difference. So instead of asking only, how much testosterone do I have? A better question may be, what has changed in my overall health? And that brings us to a change that may actually be the most important one in this entire conversation, because sometimes what looks like a sexual problem is really a health warning. Now we come to perhaps the most important health lesson in this entire conversation. Sometimes a change in sexual function isn't really a problem with sex at all. It can be a clue that something else in the body deserves a closer look. This does not mean that every erection problem is a sign of serious disease, and it certainly doesn't mean you should become frightened every time your sexual response is different. But it does mean you shouldn't automatically blame every new sexual change on age. Remember what we discussed earlier. An erection depends heavily on healthy blood flow and communication between the brain, nerves, and blood vessels. Think of your blood vessels like a network of small roads. If those roads are healthy, blood can travel where it needs to go. But if the roads become narrowed or damaged, circulation may not work as efficiently. Conditions that affect blood vessels can therefore influence erectile function. High blood pressure, diabetes, high cholesterol, smoking, excess body weight, and cardiovascular disease can all play a role in vascular health. Diabetes deserves particular attention because over time, high blood sugar can damage both blood vessels and nerves. Those are two systems that are important for normal sexual function. Smoking is another major factor because tobacco exposure can damage blood vessels and reduce healthy circulation. And then there is sleep. A man who consistently sleeps poorly may experience lower energy, changes in mood, increased stress, and reduced sexual interest. Poor sleep can become part of a much larger cycle in which the body simply doesn't function at its best. This is why sexual health can sometimes act like a dashboard warning light. Think about the warning light in your car. When it appears, it doesn't tell you exactly what part has failed. It simply tells you that something deserves attention. Sexual changes can sometimes work in a similar way. A persistent change doesn't automatically tell you what the problem is. But it may be a reason to take a closer look at your blood pressure, blood sugar, medications, sleep, cardiovascular health, or other factors. For example, suppose a 61-year-old man notices that his erections have gradually become less reliable. He assumes, well, I'm getting older. But perhaps he has also gained weight, stopped exercising, developed high blood pressure, and hasn't had a health check in several years. The erectile change may not be the disease itself. It may simply be one reason to stop and ask, how is the rest of my health doing? This is also why persistent symptoms deserve more attention than an occasional bad day. If you experience a sudden major change in sexual function, ongoing erectile difficulties, a significant unexplained loss of libido, or unusual fatigue, consider discussing those changes with a qualified healthcare professional. The same is true if sexual changes occur alongside other concerning symptoms, such as chest discomfort, unusual shortness of breath with exertion, major changes in urination, or symptoms that continue to worsen. That doesn't mean you should diagnose yourself. It means you should pay attention. And perhaps the most empowering idea here is this: your body doesn't always give you a clear explanation when something changes, but it often gives you clues. The goal isn't to become afraid of those clues. The goal is to notice them early enough to make informed decisions, because sometimes the most useful question isn't, why can't I perform like I used to? It is, what might my body be trying to tell me? But there is still one more change to discuss, and unlike the previous ones, it has much more to do with what happens when a man gradually disconnects from intimacy, confidence, and relationships altogether. There is one more change that can happen after a long period without sexual intimacy, and it may have less to do with your physical body than with the way you see yourself. For some men, going years without intimacy becomes completely normal. They are comfortable being single. They have meaningful friendships and family relationships, and they simply don't feel that sex is something missing from their lives. There is nothing inherently wrong with that. But for other men, especially those who want intimacy again, a long break can create uncertainty. Imagine a 67-year-old widower who meets someone new after several years alone.